Hey everyone, Luke here with the Knee Replacement Therapist. In this episode of the Need to Know Show, we're going to go over another common question I get, and that is, when can I kneel, or can I kneel, after knee replacement surgery? You can go up and down the stairs, you can walk, you can do all these different things, but kneeling just seems to be one of those things that takes so long to be able to get back to doing safely and effectively. So let's jump into that. Before we do, please be sure to hit that subscribe button, turn on the notifications to catch all of our latest videos. So the short answer when it comes to can I kneel after knee replacement surgery is yes. Most people can kneel after surgery. Now there are some surgeons who will say not to, who will still recommend not to, but all the literature, all the input that I've seen and read says that the knee replacement can definitely tolerate and manage the stresses that come with kneeling. Now the question is, can your body? So for most people, it can be very painful, very uncomfortable, and just not the most enjoyable thing to kneel, especially after a knee replacement surgery. So for most people, surgeons, physical therapists, we recommend waiting at least 3 months to really try to kneel. But you're going to have some discomfort. You're going to have some pain, some stiffness. But what's important to keep in mind is discomfort and pain doesn't necessarily mean you're causing any damage or harm. So there's definitely a lower threshold to causing discomfort and pain, which is something important and something we want to avoid, most of the time. But it's important to understand that that discomfort and pain is not actually a sign that there's actual physical damage occurring to your knee replacement or to your body. So why is it so hard to kneel, and why is it so uncomfortable and painful after surgery? Well, there's a couple of reasons. One is you're putting pressure right on your kneecap, usually, right over the incision where they cut open to put in your knee replacement. So that's going to be a very sensitive area. You're going to have probably some numbness still in parts of that area, and that's just really uncomfortable. You're also going to have scar tissue deeper down within the knee joint. So that scar tissue is still probably very sensitive. It's still healing. So that soft tissue in and around the knee joint is going to be uncomfortable if you put that pressure that you feel when you kneel on the knee. There's also just a general fear, a general anxiety that comes with putting your weight onto that one knee. Even though I just talked about how, you're most likely the vast majority of times not going to cause any actual damage or harm. It's hard to, kind of conceptualize that. It doesn't intuitively make sense when you're having that pain and discomfort to think that, oh, this is perfectly okay. I'm not going to damage my knee replacement. So what can we do to work our way up to kneeling and being able to tolerate it after knee replacement surgery? So a couple of things you can try are, one is start with higher surfaces. So what I mean by that is trying to lean and kind of partially kneel, if that's kneeling into the couch, into a bed, something that's a little bit higher up, which doesn't require quite as much motion and as much pressure through that knee joint. You also want to use soft surfaces. So like I said, you're using the couch or the bed. You can use pillows. Something that you can do is if you get a real big stack of pillows and try to kneel onto the pillows. And what you can do is, as you build up confidence and you build up tolerance, is take a pillow out and then try kneeling on a few less pillows, take a pillow out. And that's a way that you can progressively get lower and lower to where that eventually maybe you only have one pillow and you're kneeling on one pillow, and then you can take that out, and then eventually you're kneeling on the floor. Things you can use as well are a soft kneeling pad like a yoga mat, or you can fold up a towel. Things like that are very helpful to use. And what you can also do is just focus on outside of kneeling, just your general strength, range of motion, mobility of the knee joint. The more you have strength, the more you have good mobility, decreased stiffness of the knee joint, the more you're going to tolerate some of these more stressful positions, such as kneeling on that leg. So other things you can think about is, like I said, that area is very sensitive, right? So what we can do is some desensitizing strategies. So that might be using light massage, rubbing some lotion, or rubbing a towel or a cloth over the incision and around that soft tissue of your knee joint. You can practice doing short intervals. So again, starting at a higher place, starting at a softer surface, we can also do shorter duration. So maybe you're only kneeling for 5 or 10 seconds. Then as that you build up the tolerance to that, we're going to kneel for 15 seconds and progressively get longer and longer to whatever your target is. If that's a minute, if that's a few minutes, whatever that may be, progressively building up that tolerance with duration as well. And just be cautious, be careful. You want to listen to your body, listen to what your knee says. So if you're getting increased swelling, significant increases of pain that is difficult to get back down and calm down, feeling of instability or looseness of the joint, are just things to kind of, okay, yellow flag, let me take a look what's going on, let me give this a break a little bit. Maybe talk to the doctor, maybe talk to your physical therapist, just to make sure that we're not causing any issues or concerns. So I hope this was helpful. Again, kneeling is definitely possible. The thing is, it can be tricky, it can be uncomfortable and painful, and it takes kind of a progressive approach to desensitizing your knee and building up that tolerance to be able to do so after surgery. Thank you for watching. Be sure to hit that like button. Be sure to leave your comments and questions below. Thanks again.